Don't be afraid of monkeypox. Just when we thought we were through with COVID-19, another disease is rearing its ugly head on the global horizon. The media is assuring us this is the next great pandemic and that we should all be very afraid, or as President Biden recently said, at least concerned. Monkeypox is not COVID-19. Monkeypox does not spread like COVID-19, and monkeypox is not smallpox. Though the viruses of each disease are related, they're not the same. So what is monkeypox? In the early 1950s and 60s, the world underwent a massive effort to eradicate smallpox from the human population. There was a global immunization program pushing a smallpox vaccine that was safe with minimal side effects. This helped prevent anyone from being infected with smallpox for the past 5 decades. But smallpox and monkeypox are not the same. In 1970, monkeypox was detected in a 9-year-old African boy. It was believed he had gotten the virus from eating bushmeat, meat from animals that were killed in the jungles of Africa. Monkeypox does occur in monkeys, in rats, in prairie dogs, and because of this, there was even an outbreak in the United States of monkeypox in 2003 from prairie dogs that carried it. In that outbreak, nobody died. Why? Because monkeypox is not that deadly. In Africa, the mortality rate of monkeypox, in other words, those who would die from it, was about 1 to 10%. Those who actually passed away, that 10% in Africa, died mainly because they were in weakened immune states, the very young, the very old, or because the medical care in Africa available to them was of minimal quality. So, what should we do here in America? Well, first, be educated about monkeypox. For example, how do you know if you have it? The signs and symptoms are relatively easy. First, you get a fever, accompanied by some chills, then a massive headache or backache. This can be accompanied by anorexia, which is just a complete loss of appetite, shortness of breath, or cough. Usually within 2 to 3 days after the fever, you'll get swollen lymph nodes, especially here under the chin, in your armpits, or in your groin. The famous pox rash that everyone fears is actually painless, and it doesn't even itch. And that may start anywhere from 1 to 10 days after the fever. The rash usually starts on the face and then spreads down. In about 2 to 4 weeks after all this begins, the fever and the cough and the headache and the chills, this rash will stop being oozy. Sometimes it gets a little oozy. It'll crust over and it'll be done. That's the end of monkeypox. How is monkeypox spread? Well, it is spread sometimes through respiratory droplets. It can also be spread by coming into contact with one of those pox rashes. Should we be afraid of it? No. Most people that get monkeypox are going to be fine. Only those people with severely compromised immune systems might be hospitalized. And by severely compromised immune systems, we're talking about those with active HIV that is not being successfully treated, those who are on immunosuppressant medications for whatever reason, or those who are receiving treatment for cancer, radiation, or chemotherapy. They need to be more vigilant, and if they come down with those symptoms, that are concerning for monkeypox, then of course they need to seek health care right away. What is the mortality rate of monkeypox in the United States? Well, from the 2003 outbreak, we know it is 0. No one in our country has ever been recorded dying from monkeypox. What is the spread rate? We call this the R0 factor. Well, for the United States, it's pretty low. Most people exposed to monkeypox will not actually come down with it. Why is it this low? For Americans at the age of 50, like myself or older, we have already been inoculated against smallpox. Remember that global effort to eradicate smallpox? The monkeypox virus being related to smallpox but not being the same, we have found smallpox immunization actually protects from monkeypox. So we already have herd immunity in the United States. Does this mean no one will get it? No. Some people might. Again, if you come down with symptoms that you are afraid might be monkeypox, go talk to your doctor. There are tests that can be done to determine if this is truly what you have. You probably don't. But if you are diagnosed with monkeypox, what should you do? Should you panic? No. Most treatment for monkeypox is supportive treatment. What does that mean? You go home, you stay home from school or work for 2 to 4 weeks until all your symptoms have resolved. This includes if you break out in a rash, those rashes have crusted over, and then you return back to work or school. What if you're concerned that you are getting severe symptoms, say shortness of breath? Well, then of course, immediately contact your physician. Supportive treatment doesn't include just quarantine. It also includes being well hydrated with water, not with sugary drinks, not with juices, not with caffeinated drinks like coffee or tea. Water's your friend. It also means getting plenty of rest. Are there medications for monkeypox? There actually are. In 2019, the FDA approved a vaccine for monkeypox to be given only to those who are highly at risk for severe symptoms if they get or are exposed to monkeypox. Does this mean everyone should get the vaccine? No. It only means those people who are at our higher risk. Who are those people? Those with compromised immune systems, like we talked about a few minutes ago. The name of this vaccine is Jynneos, and it should not be given to the entire population, only to those with compromised immune systems. What if you get monkeypox and you're just miserable with your symptoms? Are there any medications to help with that? There actually is. There's a medication that can be taken through IV or even orally called tecovirimat. Tecovirimat fights the virus of monkeypox. But we should not take tecovirimat to protect ourselves from getting monkeypox. It shouldn't be taken prophylactically. Why? You don't need it. We already have herd immunity protection in this country. And for the few people who might get or be exposed to monkeypox, statistically, they're going to be fine. So don't panic. Don't be afraid. The media, for whatever reason, is blowing up this disease. Don't fall for it. If you're concerned, contact your doctor or your medical health professional. And as always, trust God. I'm Dr. Gottlieb for First Do No Harm.